Hi, I'm Dr. Cleeman. This video we're going to be helping people who are having surgery by telling you about what your day is like. A lot of the fear comes from being unfamiliar, so we're going to try to change all of that. And besides that, we're going to give you 10 tips to make your day more successful. So you come to the hospital, and the first thing you need to do is check in. And it's really important when you check in that you bring your photo ID and you also bring your insurance information. They need that information. From there, they're going to get you changed into that wonderful hospital gown, sort of like pajamas, and they're going to bring you up into the holding area. The holding area is where you're going to see your surgeon again and where you're going to meet the anesthesiologist, usually for the first time. From there, they're going to bring you into the operating room. And in the operating room, you'll see a whole bunch of equipment. The first thing you're going to see is the beach chair. The beach chair is where you're going to be sitting for your procedure. It is a little bit different than going to the beach. And you'll see other equipment there, such as the anesthesia equipment. You'll see the monitors. And those are all part of the things that we need to do your procedure. But wait, before you can have surgery, you need to speak to the anesthesiologist about what kind of anesthesia. And that's tip number one. Is that conversation. And there's different choices. There's general, where you go to sleep for the procedure, and there's also regional. Regional is when you get an injection here, and that numbs up your whole arm, which is really nice because you don't feel any pain, and you go home pain-free, but it does wear off after a little while. Another choice is what's called an interscalene catheter, where they give you that injection, but it could last for 2 days, and you go home with this catheter that you take out. Many patients will do a combination of the regional block and the general anesthetic, but have a conversation with the anesthesiologist and with your surgeon to see what's going to be best for you. We're going to move on to the other 9 tips coming up right now. Okay, so that brings us to tip number 2, and what that is go to physical therapy before your surgery. 2 points here. One is get your muscles and body into a little bit better condition before the procedure. That's going to help you after. The other important part is, hey, after you do your surgery, there are lots of things that we take for granted that you're going to have difficulty doing. Like how you're going to put on a shirt, how you're going to put on your pants, your socks, your shoes. Remember, you can't use your arm after you've had the rotator cuff surgery. Your arm's going to be in a sling. How are you even going to put on and take off your sling? So this is where going to physical therapy before surgery can really help you and make a big difference after the procedure. Tip number 3, get an ice machine. So there are lots of different types of ice machines out on the market, but ask your surgeon about which one works for you. It's really helpful in terms of getting rid of pain. After surgery, this constant cold on the shoulder and also some of the compression, a lot of our patients have found really can make a difference and can really help alleviate a lot of the pain. Tip number 4, get a pillow wedge. Going to sleep after a rotator cuff surgery or shoulder surgery is often very difficult, and lots of patients complain of a lot of pain at night, and sleeping is just hard for them to do. And we've found for many of our patients who have either used a lot of pillows to prop them up, but many have tried the pillow wedge and have found that that can really help reduce their pain at night and help them get to sleep. Tip number 5, make sure that you get your pain medication before the day of surgery and get it filled in the pharmacy, and make sure that you have it at home before you have your surgery. This will make it really easy, so when you get home, your pain medication's there and you don't have to worry about going out to the pharmacy. Tip number 6, have someone take you home. So many hospitals and many states have rules that a patient who has surgery must have someone take them home. So remember, please bring someone with you to take you home from surgery. Tip number 7, know where you're going. I know that sounds funny, but many hospitals and institutions have multiple buildings. So you really want to know which one it is and exactly where you're going, because the last thing you want on the day of surgery is trying to figure out where to go. Even simple things like where's the parking lot. Now this is all important because before surgery you often have to get to the hospital a few hours before the procedure, because it does take some time to check in and do some of those pre-surgery procedures. Tip number 8, wear loose, comfortable clothes. So on the day of surgery, when you go to the hospital, you want to wear comfortable clothes. Also remember that after the surgery, you're going to be wearing a sling. So you have to wear something that's loose and easy to get on. Many patients will wear a button-down type of shirt because that's much easier to negotiate and get on with a sling. The other thing to remember, don't wear contact lenses. You're much better off wearing your glasses. Don't bring any jewelry with you. And we usually recommend removing any nail polish that you might have on. Tip number 9, don't eat or drink anything after midnight. So I know in the morning you want to have your coffee and things like that. Don't do it, or they're going to not let you have surgery that day. That's really important. Please check with your surgeon exactly when they want you to stop eating. Okay, the last tip, tip number 10, and that's check your health insurance coverage. So you just want to, before surgery, find out from your surgeon staff exactly what are you going to be responsible for. You may need to call your insurance company, what's your copay, and you want to know that information beforehand. If your surgeon does or doesn't take your insurance, you still want to find out whether or not the hospital accepts your insurance. And you also, really importantly, want to find out, does the anesthesiologist take your insurance? You want to make sure that you're not going to get a big bill at the end that you weren't prepared for. So just get that information beforehand. I think it'll be a big help and make your day a lot less stressful. Those are our 10 tips to make your day of surgery a little bit more successful. When you're ready to go home, which is usually about 2 hours after the procedure, don't forget you need someone to take you home. That was one of our tips. The other thing is usually you'll get a handout, a sheet with some instructions. Those are important. Remember to take that with you. It'll give you information such as when you can take the bandages off, when you can shower, and other important information. The last thing to remember is, don't forget you need a follow-up appointment with your surgeon. So those are our 10 tips. We hope they were helpful. Please feel free to share this with any friends or family or any patients you know that may be having surgery. We think this can really help. Have a great day and thank you for watching.